It's Graham here from Taylor Dental Care in Keighley. I just want to clear up a few things regarding porcelain veneers and discuss how they compare with composite veneers. Now, I think they've got quite a bad reputation, porcelain veneers, and this is largely due to people going out to Turkey for their cosmetic treatment, but also possibly related to celebs that you see on TV who have these very artificial looking veneers done. Now, firstly, I just want to say, whenever I'm planning out a course of cosmetic treatment, I want to achieve the patient's goal by being as minimally destructive of tooth structure as possible. So it's as healthy as it possibly can be for the tooth, so you hold on to your teeth for as long as possible. Now, when people go to Turkey, they have their teeth shaved down to stumps. This is not a porcelain veneer. A porcelain veneer is like a false nail which is attached to the outer surface of the tooth and involves removal of a very thin layer of tooth structure. Now, why do we do them? Well, the obvious answer is we do them to change the appearance of the tooth, but we more do it to change the appearance of teeth when there's quite a lot that needs changing. If we just wanted to change the colour of a tooth, we'd probably just look to doing whitening. But if you want to change the shape, shade and colour, then we'd probably look more along the lines of either composite or porcelain veneers. So what's the difference between a composite veneer and a porcelain veneer? So composite is a great material and it's applied directly to the tooth. It's much cheaper than doing a porcelain veneer. But however, the problem with composite is it just doesn't last as long because of the polishability of it. So it can polish up and it look really nice to start off with, but over time it can just deteriorate, and deteriorate at a quicker rate than a porcelain veneer. So a porcelain veneer is made at the lab. It can look really natural or artificial, whichever way you want to look, and they apply a glaze at the lab, which means that it lasts a lot longer than a composite veneer would. However, it's more costly and we need to take a bit more tooth structure away. So what goes into the planning? So when we're planning the porcelain veneers, it's the most important stage for because there's three people involved. There's the patient, there's me, and there's the lab technician. Now, I can't decide, and the lab technician can't decide what will look good on your tooth or teeth. So it's essential that we have a staged approach to that. And it's very similar to when we do composite veneers, whereby stage one, we can put an idea of what your teeth look like on a digital image, on a photo of you. So it's almost like a Photoshop of the end result before we do anything to you. We can then, if you're happy with the appearance of that, we can then move on to the next stage, which is trialing it in your mouth. A really important stage. You can look at it in the mirror, check that you think it looks all right. And then if you're happy with that, then we go on to the final stage, which is placing the veneers. And, you know, hopefully that will mean that you have exactly the right result and very happy with it. So if you want to get booked in to consider possible porcelain veneers or any other bit of cosmetic treatment, then please don't hesitate to get in touch, and I'll look forward to seeing you soon.